On Business Insight today, we take a look at global trends shaping Nigeria's healthcare sector. Welcome aboard. It is a pleasure to have you join us this morning. I am Vivian Oguche. Let's get this ball rolling with the top stories in the world of business. Now, the federal government is set to commence the distribution of a 15 million households conditional cash transfer program by leveraging widespread mobile phone use. The president of the Fiscal Policy and Tax Reforms Committee, Taiwo Oyedele, suggested this move to streamline and enhance the efficiency of fund transfers. The program aims to provide a 55,000 naira cash transfer to 15 million households. The plan includes the development of a national portal for fund validation. Also, the government will suspend multiple taxes to support small businesses. Now, this will be enhanced and balanced by windfall revenue from certain agencies. Also, government says it will raise personal income tax exempt thresholds and personal relief allowances to ease the financial burden on individuals. In another development, the Minister of State for Petroleum Resources, Heineken Lopobiri, has announced the federal government's plan to cancel most of the licenses granted to marginal oil field operators in 2021, citing their non-operational status. Only 3 out of 100 licenses remain operational, and these 2 may face revocation once the 3-year operational deadline expires. Now, this move follows a previous cancellation in January 2022 when 33 companies had their licenses revoked for failure to meet payment deadlines. In a bid to enhance exploration and production, the government intends to conduct a new oil bidding round, signaling a significant effort to optimize the country's oil resources and promote operational efficiency in the sector. And now the Central Bank of Kenya has acknowledged that the Kenyan shilling's exchange rate against the US dollar and other hard currencies has been artificially overvalued, which has put significant pressure on the country's forex reserves. The exchange rate had been maintained at the cost of depleting foreign exchange reserves. However, this policy is changing as the CBK recognizes that it can no longer defend the shilling's value. Factors contributing to the shilling's depreciation include a strengthening US dollar, rising global commodity prices, reduced dollar receipts from agricultural produce, and increased debt servicing outflows. The shilling's depreciation is expected to continue, with a significant decline already recorded in the first half of the year. The Central Bank's indicative exchange rate has also reflected this trend. Now, it is crucial for the country to manage its forex reserves and seek ways to stabilize the currency. Stock, commodities, and currency market trends comes after this break. Stay tuned. Now, at the conclusion of Wednesday's trading session on the Nigerian Stock Exchange and NGX, a total of 329,660,250 shares were traded in 5,998 deals. This trading activity corresponds to a market value of 4,410,533,590,590 Nigerian naira and 53 kobo. Compared to the Tuesday's NGX trading day, Wednesday's data indicates a 3% increase in trading volume, a 30% decrease in turnover, and a 4% decline in the number of deals. Now, the current market capitalization of the Nigerian Stock Exchange stands at 36,900,000,000,000 Nigerian naira. Now, 120 equities listed on the NGX participated in trading, with 23 gainers and 18 losers. Multiverse Mining and Exploration led the gainers with a 9.74% increase in share price, closing at 2 naira and 93 kobo per share. This was followed by Charms Caverton Offshore Support Group and FTN Cocoa Processors. Now on the losing side, eTransact International experienced the most significant decline, with its share price dropping by 10% to 7 naira and 56 kobo per share. This was followed by Sunu Assurances Nigeria, Deep Capital Management and Trust, and Eterna. Now, Fidelity Bank recorded the highest trading volume with 50,300,000 shares traded, followed by Access Holdings, CAMS, and the United Bank for Africa. And now, at the conclusion of Wednesday's trading session on the Botswana Stock Exchange, a total of 3,670 shares were traded in 7 deals. This trading activity corresponds to a market value of 24,869 Botswana Pula and 64 DB. Compared to the previous BSC trading day on Tuesday, Wednesday's data indicates an 83% decrease in the number of deals. The current market capitalization of the Botswana Stock Exchange stands at 598 billion 200 million Botswana Pula. 4 equities listed on the BSC participated in trading, with one loser, Botswana Insurance Holdings, experiencing a 0.1% decrease in share price. Botswana Telecom Corporation had the highest trading volume with 1,200 shares traded, followed by Botswana Insurance Holdings, Chu Energy, and Absa Bank Botswana. Well, in the commodities market, wheat is being traded at 570.25 US cents per unit. Gold is valued at $1,977.40 US dollars per unit. Silver is priced at 22.85 US dollars per unit. Copper is being exchanged at 3.59 US dollars per unit. Lastly, Brent crude oil is trading at 88.08 US dollars per unit. And that wraps it up for the news segment. The show continues shortly. Stay with us. Well, thank you for staying with us. Now, digital technology has become an integral part of daily life. Now, experts say healthcare delivery can be improved by taking full advantage of the interconnectedness that technology affords in the world of business when it comes to the healthcare sector. Now, according to reports in 2022, that's in addition to startups and e-commerce giants, physical pharmacies also launched online operations in response to the new normal that was birthed after the COVID-19 pandemic. And so today we take a look at how global trends are shaping the business landscape of Nigeria's healthcare sector. And joining me virtually is Dr. Oladoyin Odubanjo. Thank you, Dr. Odubanjo, for joining us today. Well, I understand that he'll be joining us shortly. Let me just give you a brief introduction of who our guest is going to be. He is the Executive Secretary of the Nigerian Academy of Science and a past chairman of the Lagos State chapter of the Association of Public Health Physicians of Nigeria. Dr. Odubanjo, his experience covers clinical medicine, hospital management, and consulting in the science space. And he has spent several years now trying to bridge the evidence to policy gap. Dr. Odubanjo, thank you for joining us today.
Morning, it's a pleasure. I hope you can hear me clearly.
Absolutely, I hear you clearly, and it means you hear me clearly too. So let's talk about the business landscape of healthcare in Nigeria, right? Nigeria is classified as a region with isolated palliative care provision by the Worldwide Hospice Palliative Care Alliance and the World Health Organization. So, Doctor, we are going to be talking about this in a little while. But first, let's talk about how the healthcare industry in Nigeria is leveraging on technology to make things work in the country. If you listen to my intro, I would like for you to react to that.
Well, I would say that we are not doing much of that yet. But as we all probably know, the world of technology, artificial intelligence, automation is something that affects everything now. It spans into every sector and definitely is useful for the health sector also. Introduction, one of the things that limits it, of course, for a place like Nigeria and actually everywhere is the cost of implementation of some of these interventions or new innovations and technology. So it's useful through the span of healthcare, that is from diagnosis going down to treatment. It spans everything to administration, so every aspect of it is influenced now by AI and all of that.
So we're talking about digital health and how practitioners and entrepreneurs are leveraging this equipment, or how will I say it now, this tool rather, to improve access to medicines as well as all other healthcare services in Nigeria. So let's go to the hospices, right, which is actually called palliative care provision. Like I said earlier on, Nigeria is classified as a region with isolated palliative care provision. What does that mean, really?
It means that palliative care is a branch of medicine that is, should I say, fairly new. Some define it as the provision of end-of-life care or care for people who are critically ill. So in that sense, you're unable to provide a cure, but you're able to palliate. You're able to ensure that the person lives comfortably for whatever duration of life they have, whether they are terminal now or they're not terminal, but they are facing a chronic illness, debilitating illness that really limits their lives and their functionality. So if you have someone, for instance, with terminal cancer, nothing more can be done. You want to ensure that this person is comfortable. So whether they had pain, you want effective pain management. You want to ensure that they can live and die if need be, comfortably. And when they say that we have isolated palliative care, it means that it's not pervasive in our own environment yet. It's not something that you'll find commonly available. I happen to be an advisor to what's known as the Center for Palliative Care in Nigeria, which is based in Ibadan, which is one of the main organizations that has been pioneering the palliative care in Nigeria. So if you take palliative care, for instance, in Nigeria, there are very few people with the expertise in that field right now. University College Hospital Ibadan has one of the first palliative care centers. I think it's the first palliative care center, which is actually an outpatient center where you can take such people to, just like you go to any clinic, but their specialty is palliative care. So you don't have that in many places. I think Ilorin also has a department like that, which Ibadan was also, collaborating with them to start, or collaborated with them to start. So you have it isolated like that. So I can talk of Ibadan, I can talk of Ilorin, so you won't find in most states, for instance, that palliative care is established properly in those places. So that's what they're talking about, that people cannot access that care, just like you would access, say, obstetric care in virtually every state in the country. Thank you.
Thank you so much. Do you think this is a lucrative area that business entrepreneurs in the healthcare sector could actually cash in on?
Well, it is actually, because again, when we start looking at the situation that we have, our social infrastructure that is disintegrating, and by that I mean that, in the past, what we used to have, it's not palliative care, but what we used to have that helped people, to live and die happily, in quote, was the fact that we had a strong social environment. So extended families will step in when somebody was very ill. You could be sure if the children were not available, the sister is available, the cousins are available, the nieces are available, the nephews are available. But now everybody, for instance, you find that all of those ones, the younger generation are gone. There's no extended family that you can put people with, and people can say, look, I will take care of auntie, I will take care of uncle, he can stay with me, or he lives down the road from me. So all of those things are now more difficult because of migration to start with, so we've and also because of modernization, we are no longer as cohesive and as social as we used to be. So there are things that have made it now imperative. So many people abroad, for instance, now have elderly parents who need support, who need palliative care, and they now want, they're willing to pay. They're willing to pay for the services. But the real question now will be, how do you ensure that you get proper care from qualified people who should provide that kind of care for your loved ones? So it's lucrative. The business opportunity is there, but also we need to guard against quackery, as it were, of just anybody trying to do it just for the money's sake and not being able to provide a quality service that is required.
So let's quickly transit to the other topic, which is tied to this, the proposed budgetary allocation to Nigeria's healthcare sector in 2024. Are you impressed with what has been proposed so far?
Actually, tell you the truth, I've not really looked at what's been proposed. But the real issues, I think we need to get back to the rudiments of how we budget. Again, in fact, now I think we're in a very dire, critical situation. Because whatever we even propose, the questions that, arise around our budgeting process, which is, how do we arrive at those figures? What do absolute figures really mean in terms of healthcare? So 2023, we had over 1 trillion naira budgeted. The questions to ask are, was that money even released at all? Whatever was released out of that money, when was it released? So you have situations where, for me, I would say that absolute amounts don't matter very much right now in Nigeria as to effective implementation of whatever we have budgeted. Okay, so, and by that I mean that if we had over 1 trillion naira budgeted for 2023, was that money released at all? First, in fact, maybe before we even say that, the question is, how was that figure arrived at? So you have budgetary situations where people are bribing to get their budgets passed, meaning that this thing is not based on any rationality. I just have to pay and then my budget is passed. We've heard about budget padding. That's also a problem. The question also arises as to when people say, well, we don't have the money, we need to cut it down, and they just cut out line items. Without the rationale of defending. I knew of a situation years back, actually, where they told me a unit in the Ministry of Health had their whole budget cut out because they were trying to reduce the budget. It was just cut completely. And when they told me, I said, that's unbelievable. They said, yeah, that's exactly what happened. They just said, we need to reduce this, remove this, and they just cut it off. I said, but they're going to pay the staff in that unit, in that directorate. So you are paying the staff, therefore, to do nothing. That's what you have just said by canceling all the money they need for functionality. So we go to those issues of how do you arrive at the budget finally. We go to the issues of, was it released? Do we ever release the money? We go to the issue of when we release it, when do we release it? So if you budgeted 1 trillion, for instance, and then you don't release the money until October, what then happens because of our zero budgeting policy is that all kinds of bogus activities will take place between October and December because they will be trying to spend that money and arrive at zero. Okay, to say that their budget performance was very good, they will try to spend the money. But if I budgeted, I needed 1 trillion to do several activities from January to December, and you only gave me the money 3 months to the end, I didn't spend that money effectively. So I think we need to look at the effective implementation of budgets first before we start being bothered or excited about whole figures. Thank you
so much. So there's a report my colleague Alfreda Amebasi put together on this very topic. I'd like for you to take a listen to it, and then when we come back, we'll have your reaction.
The allocation of funds to Nigeria's health sector has been a persistent concern, with allocations consistently falling short of the recommended 15% benchmark set in the Abuja Declaration of 2001. Despite recent increases, the 2023 budget allocation, which amounts to 5.75% of the total budget, still falls significantly short of this commitment. This financial shortfall has resulted in deficiencies in the healthcare system, including inadequate infrastructure, a shortage of medical personnel, and insufficient essential medical supplies. The consequences of these inadequate allocations are widespread, affecting the capacity to provide quality healthcare services, infrastructure development, and the availability of essential medical supplies and personnel. Corruption and mismanagement have further worsened these issues. Disparities in budget allocation across different states and regions have created inequalities in healthcare access. To address these challenges, it is crucial to advocate for increased budgetary allocations to the health sector and ensure transparency and accountability in fund management. To improve the health sector, a focus on specific healthcare programs such as immunization, maternal and child health, and disease control is essential to make efficient use of the available resources. Enhancing budgetary allocations to the Nigerian health sector is vital for providing quality healthcare services, addressing infrastructure gaps, and ultimately improving the health and well-being of the population. Alfreda Amebasi for Business Insight.
Thank you so much. Doctor, what Alfreda talked about in a nutshell is commitment to Nigeria's healthcare sector, and it's called health security. How committed is Nigeria, government, and entrepreneurs in this field committed to health security?
Well, I think the word commitment is a very big word, and we can really question the commitment if we look at how things are falling apart. We'll question the commitment a lot, and we'll do so on the basis that when we saw genuine commitment, we saw performance. So when in 2014 we saw an Ebola outbreak, the world was shocked that Nigeria curtailed it in 93 days. When in 2020 we saw COVID-19 outbreak, relatively Nigeria's performance was quite good. Relatively, I mean, there were lots of issues, yes, but that's a global challenge. But again, relatively, we didn't fare badly. One major thing that everybody agrees on in those two instances was that the commitment was there. So in between, and now we will question that commitment because we see all of the problems that have bedeviled us seem to carry on. So how we deal with the money, seems to carry on. In fact, if you go back because we're talking about budgets, if you go back to 2001, there was an African Union meeting and there was an agreement that in order to improve healthcare, we need to have what they call the Abuja Declaration of 15% of your budget should go to healthcare. We have not gotten anywhere near 10% since then till now. So again, that bedevils the question of commitment. But that doesn't mean that there are not fragments and sections and individuals in the system who are trying to get things to work. But again, that's why we talk about the health system, meaning that one part can't get it to work effectively. One person can't get it to work effectively. We must have a cohesion of vision, a cohesion of commitment, and we must all move together, towards the same goal. We must have the same view of healthcare. And so while some people, for instance, are looking at healthcare as infrastructure alone, they want to build a building and put a plaque with their name on it. They want to buy one expensive equipment. There are health experts who will tell you it is the system that you need to address. You need to look at the whole system and you need to address all of the parts of the system here and there. Of course, some with more weighted priority than others. And except you do that, you cannot get real impact in that sector. Okay, so I would say that I wouldn't say we're committed because definitely things are falling apart, and that speaks or challenges our commitment as a country towards healthcare or health security. Thank you.
Thank you so much. There's something you said about COVID-19, which is going to let me lead you to somewhere else I need us to talk about. Now, more than 80 companies are digitizing distribution of health products in Nigeria, Uganda, Kenya, and Ghana, right? This is following the 2019 COVID-19 pandemic. Now, these innovations offer a range of services such as digitizing distribution to providers and consumers and product data services. The trend also showed that innovators who digitize distribution to providers appear to be growing with a strong user retention rate estimated at 46%. As one of the major players in this field, what would be your advice to both government and entrepreneurs to leverage on this tool as regards the health sector in the country?
Well, I mean, at the end of the day, why you digitize or you come in with technology in any instance is ultimately for cost effectiveness, meaning that you want to achieve, best results at the best possible cost. So that should interest both the entrepreneur as well as the government, because one of the problems with government and healthcare is the cost of providing healthcare services to people. So you want to be sure that I can minimize that cost, and I can be very effective at what I do. So for instance, there are those who use drones to deliver pharmaceuticals to difficult or hard to reach places. So your first problem is that those places are called hard to reach, meaning that your healthcare services probably don't get there as they should anyway. And if they were to get there, there are lots of difficulties and it probably costs a lot. So if there can be a solution like drones that delivers those things, then you're happy. Number one, it's going to get there. That's your first problem solved. Number two is at what cost? So the entrepreneur also has to look at it and say, look, I need to be able to market it to the government to say, I can reach the hard-to-reach place, and I can reach it at a fraction of cost that you spend. So when I put my drone, it gets there quickly and on time, and it costs you just X amount of naira as against Y that was more that you used to spend. So that's the use of technology. That's how you do it. If you automate, or you what do you call it? If you digitize, for instance, your records, then you also again are looking at effectiveness. If you go to many public hospitals, you go there today, you come back in 6 months, they start looking for the file. But if I'm able to put all of that and computerize and what have you, all it needs is the press of a button or two, and the file comes up. The doctor is able to see it. Perhaps somebody has to carry a file from here to there. Again, the doctor sits on the computer, presses it, and the file comes up. Without anybody having to move around. Then you're looking for the person to carry the file. They said she went to eat, he went to buy something, and then you have to sit. So you eliminate all of these inefficiencies. So there's a lot of opportunities there, but we in healthcare, we must know healthcare is a social service also to a good extent. So most of the people will not be able to afford the costs. In fact, we tend to joke that most people are just one sickness away from poverty. So even your so-called rich man, if he has the wrong type of illness, can become very broke very quickly. So we have to, as if you're looking at it from the private side, you are thinking about, yes, I have innovations that can solve the problems, but you must also be mindful of the cost. Not just because government can't afford it, but also because the people can't afford it. And your best way to get in is to be able to say, look, this is the problem it solves, and it solves it at minimal cost.
Talking about cost, right? Let's take a look at funding trends as we speak. There are reports that shows that recent investment momentum has been strong in countries I mentioned earlier on, including Nigeria, Ghana, and Kenya, right? Even though funding is growing, it is highly concentrated. 72% of all reported funding in the last 12 months were focused in specific areas, not widespread. Now, such a high concentration of funding might lead to deficiencies in other aspects of the ecosystem. When we talk about the health ecosystem now, how can such gaps be plugged without heavy dependence on donors?
Well, so that takes us back to what you said earlier, which is that big word called commitment. The only way is that we have to be committed enough to our own health system. Over dependence on donors simply says that you're not committed enough to put your money where your mouth is. So you leave other people, or you beg other people, or you allow other people to have to come in and fund those things. While the real question is, can you really not afford it? Whether a lump sum, whether it's sums that come in tranches, are you truly unable to put down this cost? If we eliminate a lot of the waste we have in the system, are we not able to plug these gaps that you're talking about? So it takes us to that discussion about commitment. At the end of the day, there's that saying that also goes that where there's a will, there's a way. And that's commitment it's talking about. That once we are committed, we will find how to do it. We will find how to put the money on some of these areas, perhaps even the ones that are being donor funded. Perhaps we can even afford them by ourselves. So we would not know the accurate total answer to that until we have that commitment issue solved. Thank you.
Thank you so much. So let's talk about partnership between the private sector and government when it comes to healthcare delivery in Nigeria. How well is that going?
Sorry, can you take that again?
Saying let's talk about partnership between the private sector and government in Nigeria. How well is that going?
Well, it is coming up, and I would say particularly also because of now the need or focus on health insurance. I think that has further integrated the private sector with the public sector in healthcare provision, because a lot of that now is being driven by healthcare providers. A lot of most people with health insurance would go to a private provider. In fact, you have the health management organizations, mostly private, if not all private. Then you deal with the hospitals. Most people who have insurance also will go to a private hospital, and that is making or bringing about a further emphasis. I call it further because everyone had known that the private sector contributes significantly to healthcare provision in Nigeria. Most people depend on the private sector. There are countries where there's no private sector healthcare, or very minimal private sector healthcare, including places like Canada, very minimal private sector care. So, but we know in Nigeria that's not the case. A lot of people who can, depend on the private sector. So with health insurance, because private sector, part of the challenge was you pay more, so most people could not afford it. But with health insurance, you can, affordability issue is being solved. Because once you have insurance, now you don't have to pay out of pocket when you go to the place there, and then they say, you pay 20,000, you have 20,000 on you. Well, you've been paying 1,000. You've been putting down 500 naira every month without going to the hospital. So that's how insurance works, and that makes it possible. Now, the next place it takes us to, or it should take us to, is to revisit the conversations about, for instance, things like data usage. So all the people that are being seen in the private sector, do we have access to the data? That I'm talking now, I'm not government, but I'm talking as if I was government. That does government have access to that data? So are we able to see everything that's going on in Nigeria? Because if 40%, 50% of people go to private providers, whatever they are being treated for, if it becomes obscured, from the health managers, the public health managers in the country, then their health or the management of public health is in that. It means that we don't know 50% of what is going on in our environment. But if there's central collection, there's, all of those things are on paper, but if it becomes more efficient and the private sector is supplying its data regularly, just like every public hospital does, to a central database in the ministry and all of that, then managing the healthcare becomes better. We're able to plan better because we can see the burden of disease. We see the burden, we see the patterns. We are able to detect disease also more readily because we're able to pick up the strange diseases, or sometimes what we call notifiable diseases. So there are diseases that once you see them, you notify because they are very important in terms of epidemics and things like that, so that you can act fast before they spread fast. Okay, so all of those things become better. So hopefully, as we have a greater integration now because of health insurance, all of those discussions that have always been there, for years and years and years, become pronounced, and then we'll have better efficiency in managing our health system as a whole, which would include both private and public sector. So even things like vaccinations, we will channel a lot more through the private hospitals, so that people who are afraid, who are not getting the vaccinations because they don't trust the health post in their place, can get it in a private hospital, and it's still provided by the government through the private facility, even if it means the government pays them a token for administering it to the public. So hopefully we're getting there. Thank you.
Getting there, fantastic. It's interesting that you mentioned vaccination. Just on the 24th of October, that's this month, the federal government launched the rollout of over 6 million doses of the HPV vaccine. Doctor, I'm sure you're aware of this. HPV is a virus that causes cervical cancer, and one of the things government said was that it was looking for partnership with states, local governments, and private sector as well. Your thoughts on this?
Well, so yes, it's that's the way to go, because you want an uptake. Many people, for instance, simply even on the basis of trust their private provider more. So if they know, if I know that I can get it through there, government should not try to channel just to the public sector. So it's good we have that kind of policy statement that we're seeking partnership with everyone, including the private sector, so that we recognize that people trust their private provider, and those things should be made available there. Even when you had the COVID-19 vaccines, the mere fact that it had to go through just a few centers that are government controlled in itself was an issue for many people. So imagine that we had a system that was very cohesive, and therefore even the COVID-19 vaccines were available in some of our private hospitals. You would have had a greater uptake of those vaccinations. So any of these things, including this HPV, we need to really be looking at, involving the private sector in these things, because they see a lot of the public patients. They attend to them and they are trusted.
Thank you, Doctor. As we wrap up now, you just got a few seconds for your final thoughts on this. What should be given priority when it comes to Nigeria's healthcare sector?
I think the health workforce, because nothing works without the people. So we are hemorrhaging, healthcare workers, and we need to stop that. And the only way to do that is to make sure that their environment is comfortable for them, to work in and to live in, so that they stop living in droves as they're doing. No matter what we put in place, if they're all gone, we are in trouble. Thank you
so much, Dr. Oladoyin Odubanjo. You've always been very gracious to us when we call on you, and we appreciate that. Thank you so much.
Thank you. Thank you.
Yes. So
Have
Dr.
a nice day.
Oladoyin Odubanjo is the Executive Secretary of the Nigerian Academy of Science and a past chairman of a Lagos State chapter of the Association of Public Health Physicians of Nigeria. He also has an experience in fields of clinical medicine, hospital management, and consulting in the science space. Dr. Odubanjo also has spent several years now trying to bridge the gap, evidence to policy gap. And that is our show for you today. Thanks to everyone who made the show a success, and a bigger thanks to you for watching. We'll be back here again, same time, same station, as we count down to the weekend. Until then, I am Vivian Oguche. Have yourself a beautiful day ahead.